La Chureca was Central America's largest municipal trash dump and home to over 250 families, more than 2,000 individuals whose livelihoods depended on sorting, classifying, and selling trash. The extreme poverty conditions in this community led to violence, poor health, and limited access to critical primary health care for families. With support from our team of dedicated international volunteers, generous partners, and donors, we operated the only fully functioning primary healthcare clinic in La Chureca. Annually, the clinic staff provided over 7,000 medical consultations and an additional 17,000 medical treatments, public health measures, and nutritional support. Given the toxic and degrading environment of La Chureca, the Spanish Agency for International Development promised $45 million to close the dump, create a recycling plant, and provide housing and jobs for the families of La Chureca. In March 2013, the Nicaraguan government officially closed the dump and relocated families to their new homes in Villa Guadalupe, just a quarter-mile from the dump. The relocation brought hope, but many families faced job insecurity since they were no longer able to access the dump to earn a living. Although the government promised that one individual from each family would receive a job at the new recycling plant, many families were left jobless and are still seeking employment. During the closure, the Nicaraguan government also appropriated our clinic, leaving an entire community without access to health care. Fortunately, we relocated to a smaller, temporary space in Villa Guadalupe. The move forced the clinic to decrease staff by 40%, and consequently, we have been unable to meet the health needs facing this large community. In addition to the families from La Chureca, Villa Guadalupe is home to numerous families displaced by severe flooding. Including the adjacent community of Barrio Los Martínez, the population served by the clinic now exceeds 10,500 people. Since the relocation, the clinic staff has noted increases in food insecurity and malnutrition. Diarrheal disease, respiratory disease, influenza, chronic conditions, skin infections, and sexually transmitted infections are common, highlighting the continued need for increased health and clinical services for families living in Villa Guadalupe. To meet the immediate needs, we are moving clinical operations into a larger space, which has the capacity to include an OBGYN and a dentist. A gynecologist is critically needed to address the lack of specialized and safe healthcare for young girls and women. Nicaragua has the highest adolescent pregnancy rate in Latin America. Further, it has the highest incidence of cervical cancer in the region, making cervical cancer the primary cause of death for Nicaraguan women between the ages of 30 and 60. The only dental care that has been available to residents of La Chureca has been provided by visiting brigades from the U.S. Dentists on brigades are often confined to pulling teeth. In the new clinic, a Nicaraguan dentist will provide ongoing dental care to decrease the need for extractions through preventative care. Salaries for the OBGYN and the dentist have already been funded by doctors and dentists in the U.S., guaranteeing the sustainability of these specialty services. However, we are still seeking funding and support from our community of partners and donors to help us continue the general operations of the clinic. Basic clinic services require $2,400 every month. As you partner with us in serving the immediate health needs of this underserved community, we also invite you to join us in our vision to construct a new clinic. Final architectural plans have been designed, and with your support, we hope to begin construction in the near future. Will you consider making a donation to support our current operations and the construction of a new clinic in Villa Guadalupe? Your donation will provide critical health care for children, young people, and entire families living in this underserved community. Together, we will improve life and provide safe, reliable, and quality medical services for the 10,500 residents of Villa Guadalupe. On behalf of the staff and all of those served by the clinic, thank you.